Good afternoon, everyone. Welcome to this afternoon's research forum. I'm glad that you're able to join us here today. We are here today with a little bit of a back to basics sort of a presentation. Let's start out with just a few housekeeping items. One second. There we go. During the webinar, please mute your mics to avoid echoing or background noise. Please also avoid activating your camera in order to preserve the bandwidth of the meeting for others who are here on the call. If you have any questions, please use the chat function and a moderator will respond to your question. We'll also take some questions after the presentation if there's some time. And just to let you know, this session is being recorded and the full presentation and slides will be available on the VPR website. And the address for that is there on the screen. You can also find that by going to the VPR services website and clicking on the forum archives link. So I am very happy to be here today. I am your presenter today. My name is Krista Kilpadi. I work in the Office of Research Administration and Quality within the Research Protection Programs. My job there is kind of developing educational materials for our researchers. And our topic today, as I mentioned, is kind of a back to basics. We're calling it Human Research Approval at UT Health San Antonio. This is kind of a general overview that may be old hat to some of you who've been around for a while, but hopefully you'll learn a few things. And for those of you maybe who are newer around here and haven't learned everything about what goes on in our offices, hopefully this will enlighten you a little bit, and you'll learn a lot about what it is that's happening in the black box when you put in a research application with us. So when you submit a research application here at the UT Health Science Center for approval, there are basically three different steps or boxes that we have to go through. First of all, there's the budget and billing step. That involves the UT Health CTO and the OSP. We'll go over these in a little bit more detail during this presentation. Then we have the IRB approval step, and we also have the institutional activation step. And the way that these go together is something kind of like this. This is kind of our application process in a very simplified diagram. So we're going to go through this step by step and let you know what it is that happens when you submit these protocols. So our first question here on this slide is in that triangle, that diamond rather, to the left is this study a clinical trial? Because knowing whether or not your study is a clinical trial is going to affect where you enter the process for submitting your application. Okay, so how do you know if your study is actually a clinical trial? Well, your study is a clinical trial if it involves human participants, if the participants are being prospectively assigned to an intervention. So at the beginning of the study, you're deciding what intervention they're getting. The study is evaluating the effect of the intervention, and that the effect that's being evaluated is a health-related, biomedical, or behavioral outcome. So you can kind of see here that if you have a study that you're treating people with something and then measuring something that out of the other side that's a biomedical or behavioral outcome, chances are that that's going to be a clinical trial. So if you are starting with a clinical trial, you're going to go start with your application process through this top branch, which is the budget and billing branch. And that's not to say that you won't go through budget and billing if you don't have a clinical trial. It just happens at a different stage. So we're going to start out here talking about the budget and billing branch first. So let's start talking about, first of all, the Office of Sponsored Programs, because that's often one of the first offices you'll deal with if you actually have a sponsored research study that you're doing. The purpose of the Office of Sponsored Programs is to handle contracts, agreements, and external funds. So they handle it if you have an agreement with a commercial sponsor. They sign the non-disclosure agreements. They sign the clinical trial agreements. And you need to keep in mind that you as investigators or your PIs are not actually permitted to sign these kinds of agreements yourself. The Office of Sponsored Programs needs to do it on behalf of the university. So you want to make sure that you're working with them. They will give you a document to sign that you acknowledge that this is being done and that you know what's going on, but the actual agreement has to be between the sponsor and the university. So your PIs can't sign those directly. And the Office of Sponsor Program also handles any sorts of grant applications that you may be getting. So you've got your federal grants, any private foundation grants, all of those need to be handled through the OSP office. And finally, the OSP office also handles data use agreements. So if you have research data that you're sharing with another entity and want to make sure that you're doing that right, you're going to go through the Office of Sponsored Programs, and they're going to arrange those data sharing agreements for you. The other part of the budget and billing stage is the clinical trials office. And the clinical trials office has a little bit of a different function. Their function is, at this stage, is to approve the budgets and the payments within the study. We all love to do research, and of course we'd all love to do all the research that we can, but we really can't do it at a financial loss. So the clinical trials office helps make sure that all of the things that are in your study that need to be paid for are actually accounted for in the budget, and that you've got money someplace to pay for them. Because unfortunately, if we just run research at a financial loss all the time, we won't be doing research very long, and we want to keep doing that. So we want to make sure these things are covered. So they're going to be handling the budget negotiation with the sponsors. They'll do something called a coverage analysis, which is where they'll analyze your protocol and see what kinds of expenses might be involved in those and who is going to be paying for those, whether it's going to be your study, whether it can be billed to the insurance or Medicare, or exactly who's going to be paying for all of those items. And this includes things like if you've got participants that you're going to be paying in the study, those amounts are going to be approved by the clinical trials office, in addition to the IRB, who we'll talk about a little bit later. And also, if you're using any sort of external entities in your study, for example, if you're sending x-rays to radiology and radiology is taking the x-rays and reading them, or if you're sending blood samples to the lab and they're performing some sort of testing on those, or maybe you have another doctor who's an expert on your study who's going to be providing expertise in some manner, they need to get paid too. So all of those sorts of things are the things that the clinical trials office is going to be looking out for and making sure all of that's in order before we go on to the next stage of the approval process. So once you've passed this budget and billing stage, we go on to the next stage, which is the IRB approval stage. And that can be either at the UT Health IRB or at an external IRB. The functions are somewhat similar. We'll talk a little bit, we'll mostly be talking about what happens at the UT Health IRB. There may be some slight differences if you're going someplace else, but the fundamentals are going to be all the same. So why is it that we actually have an IRB, which IRB, in case you don't know, stands for Institutional Review Board. Their purpose is to protect your research participants. And the reason for this is that back in the 20th century, there was a lot of research that was going on that we would not really consider to be ethical today. A lot of people were harmed. A couple of the biggest examples of these were the experiments that were done on the concentration camp prisoners during World War II that resulted in the Nuremberg trials. Or another big one is the Tuskegee syphilis study, where poor sharecroppers in Alabama were enrolled in this study where they were getting spinal taps taken and thinking that they were getting treatment for a disease that they had, but really they weren't. And the study was not stopped, or treatment was not offered even when a treatment was available. So these things are the kind of things that we don't want to allow to happen today. And so it's kind of the IRB's job to make sure that these sorts of things don't happen going forward. So in 1981, the US government adopted something called the Code of Federal Regulations for the Protection of Human Subjects, which you can find in the federal laws at 45 CFR 46 subpart A. That's how you find it if you're looking for it. And this was our first law that actually protected human subjects during research studies. And there that particular regulation also became the common rule later on when it was adopted by a lot, I think it's 18 different governmental agencies. So no matter where in the government you're doing your research, whether it's with the NIH or with the Department of Energy, or all the different government agencies. They'll all happen under the same law called the Common Rule. And the Common Rule is based on 3 foundational principles for ethical research, which are found in a report called the Belmont Report. And these principles that we try to adhere to are respect for persons, first of all, which means that people should be able to make their own decisions about what happens to them, unless they're unable to make those decisions for themselves, in which case we need to protect them. We have the principle of beneficence, which means that there should be a balance between the risks and the benefits of a research study, either for the individual or for society as a whole. You can't just put people into really high-risk studies if you're not going to get really valuable information out of that that's going to help save people in the future. And finally, you have the principle of justice, which kind of means that the burden of research should be borne by the population who will benefit from the outcome. And the point of that is that you shouldn't just be able to be taking advantage of people like, say, homeless people or prisoners because they're easy to get to if they're not going to benefit from the study in the long run. You need to do the research with the people who are actually going to benefit from the study. So based on those 3 research principles, the Common Rule law sets out a list of 7 criteria for IRB review of human research. So this is what the IRB is looking for in your IRB application. They're looking to be able to answer these 7 questions. The questions are, first of all, whether the risks to subjects are minimized, whether the risks are reasonable relative to the anticipated benefits. And you can see how these kind of connect back to those Belmont Report principles, right? To the beneficence, balancing risks and benefits. You want to make sure that the selection of subjects is equitable. That goes back to that Belmont principle of justice. You need to make sure that, or the IRB needs to make sure that informed consent will be sought from each subject, except in some special cases where they are able to waive the consent in cases where perhaps the consent will interfere with the subject of the research, but the IRB has still determined that it's a safe study. Informed consent will be documented. Again, in most cases, the IRB can waive that, but in most cases, they're going to make sure that you're documenting your informed consents, that you're going to be monitoring your data to protect subject safety, making sure that unexpected things aren't harming people. And finally, making sure that there are adequate provisions to protect the privacy of subjects and the confidentiality of data. So all of those forms that you fill out for us when you turn in an IRB application, really all of those questions are intended so that the IRB can make sure that they can answer these 7 questions in a way that makes them believe that your study is going to be safe for the research subjects that you're enrolling. Now, the Common Rule says that all human subjects research must be reviewed and approved by an IRB. Technically, the Common Rule only applies to federally funded studies, but here at the Health Science Center, we do insist that the same rules be applied to all research studies, whether or not they're federally funded. And at first, when you look at this statement, all human subjects research must be reviewed and approved by an IRB, it looks like a fairly straightforward sort of a statement. But when you start thinking about it a little bit more, you might have some questions. For example, what exactly are human subjects? For instance, of course, if you've got living people that you're interacting with, that's probably pretty obvious that that's going to be human subjects. But what if you're doing research on deceased people? Are deceased people still considered to be human subjects? What if you've got pathology samples, some sort of tumor biopsy or something like that, and you're not actually interacting with the person, but this sample came from a person originally? Is that considered a human subjects research? And finally, if you're looking at people's medical charts, you're not interacting with the actual people, but you're looking at information that came from people. Is that going to be considered human subjects research? And another question that might come up is, what exactly is research even? How do you define what is research and what isn't research? And so we're going to go back to some of the rules in the federal laws that determine what is and is not included in these items. There are actually two definitions of what is considered human research, and we require IRB review if the study meets either one of these. One of the rules comes from the Department of Health and Human Services, and one of them comes from the Food and Drug Administration. The Department of Health and Human Services definitions start off, first of all, with the definition of research. And research to Health and Human Services is a systematic investigation designed to contribute to generalizable knowledge. So that's kind of an interesting definition when you think about it. You actually have to have a plan in place. It has to be a systematic investigation. And secondly, it has to contribute to generalizable knowledge. So if you're just collecting data that's going to be valuable just to you or just to a very small group of people, then that may not be considered research. It has to be something that's valuable to more people than just your local team. They also have a definition for human subjects. And according to the DHHS, human subjects are involved if data is obtained by intervening or interacting with a living individual. Again, that's kind of obvious. If you're talking to somebody, you're probably doing human subjects research. But it also includes accessing identifiable private information about a living individual. So when we go back to our examples on that previous slide where we talked about what is and isn't human research, this definition does say it has to be about a living individual. So if you're doing research on deceased people, then that's not going to be considered human subjects research. But if you're doing research on things like medical charts and you know who that is that you're looking at, it's identifiable information, then that might be considered research, depending on how you're collecting that data. And the same thing with those samples, with the pathology samples, with the biopsy or something like that. If you don't have any identifiable private information, it may not be considered research. But if you know who this sample came from and some more things about them, then it might be considered research. And that's part of what our IRB offices will determine when they're reviewing your study. And then we have the second set of definitions, which is the FDA definitions. And the FDA, of course, is the Food and Drug Administration. So they're really only interested in your research studies if you're testing a food or a drug. So they start out with the definition of a clinical investigation, which is kind of like the DHHS definition of research, which is that the study has to involve an FDA regulated test article. And generally what that means is a test article is either a device or a drug that's not generally approved for marketing in the course of medical practice. It's not something that's already FDA approved. Or in the case of a device, if the study's intended to evaluate the safety or the effectiveness of that device. And secondly, your clinical investigation has to involve one or more human subjects and produce data that will be used to support a marketing or research application for the test article. So you have to have something like a drug or a device or something that the FDA regulates. It has to be used on actual humans, and it has to be used to produce data that's going to be eventually presented to the FDA to approve this thing. If it doesn't fit those definitions, then the FDA doesn't need to look at it. So as far as they're concerned, that's not a clinical investigation. And going back to the definition of human subjects for the FDA, as far as they're concerned, human subjects are individuals who participate in the research as either a recipient of the test article, again, that drug or device, or as a control. So they don't necessarily have to get the device if they're a control in that study. But if you have those in your study, then the FDA is going to consider that human subjects research. All right, so now we've got our definitions of what is research and what is human subjects research. So we can go on to our individual categories of IRB review now that we've got that baseline. And really there are about 5 different categories that we can review things under as the IRB. First of all, we have non-regulated research. We'll go into detail about what each of these are in the upcoming slides. We have non-regulated research. We have non-human research. We have exempt research. We have expedited approval, and we have full board review. So we'll go through these one at a time and see. And we'll talk a little bit about what each of these involves. All right, so first of all, we'll start at the bottom here. Non-regulated research is research that doesn't meet the federal definitions of research that we just talked about. So examples of these would be things like quality improvement. This is something maybe you're doing in your own clinic or your own office where you're trying to make things better for the patients in your specific office, but it's not necessarily going to be generalizable to everybody else. That's, again, it's not generalizable, then it's not research. So that those would come under non-regulated research. And similarly, something called program evaluation. This is doing surveys to find out if people know about particular programs you have or something like that. Those usually come under non-regulated research. And finally, we have case reports. And case reports are a little interesting because they really have to be only about a couple or maybe 3 people to be considered a case report. If you're really just reporting on something that you've seen in your clinic without trying to draw any generalizable conclusions about them, then that will come under non-regulated research. But if you're doing case reports of more people, maybe 5 or 10 people, then we start to think that maybe you're going to try to draw some conclusions about how things come out with these patients, and then that might fall under one of the more regulated research categories. So if you have a non-regulated research project, as far as what the IRB requirements are is that we don't have to review that. No IRB review is required because this is not considered research under the federal law. Now, if you're not sure, you can actually submit your protocol to us, and we can make a formal determination for you saying this is research or this is not research, just to make sure that you've got your bases covered and that you don't need IRB approval. And finally, since we're not approving it as the IRB, there's not going to be any expiration date on these, so that you can do them as long as you want. You don't have to tell us about them because it's not something that's coming under our responsibility. Let's see. So let's go on to the next category. Non-human research is the next category. So as opposed to non-regulated research, this is research that actually is research but doesn't meet the criteria for human subjects. So that's meeting the other part of the definition. Examples of these are going to be de-identified clinical information or specimens. Like I said, if you're not looking at identifiable information on these, then it's not considered human research under the DHHS definitions. And again, if you're doing de-identified specimens from a repository, same thing. You don't have any identifiers, then you probably can do the research under non-human research. And finally, we also have commercial cell lines here. So if you're getting cell lines from whatever company or whatever, even somebody else's lab that have been established, and you don't know anything about where they came from, unless they're HeLa cells we know a little bit more about, but in most cases, we don't know who those cell lines came from, it's going to fall under non-human research. And the IRB requirements for these are going to be pretty much the same as for non-research. We don't have to review it. We can make a formal determination for you if you're uncertain about whether or not you have non-human research or not. And there's not going to be an expiration date for these because we don't need to oversee non-human research, only human research. All right. Now let's talk a little bit more about de-identified specimens, since we talked about that in the last slide there. So what exactly determines whether or not your specimens are de-identified? Well, the federal regulations actually have a list of things that you need to remove from your samples if you're going to consider them de-identified. These are things like, first of all, a name or any derivation, including initials and unique physical attributes. So anything like biometric identifiers, fingerprints, voice prints, things like that, full face photo images or any comparable images, those are all going to be things that can identify some person by name or by identifier. Secondly, we have addresses or other contact information. So that includes things like street addresses, zip codes, telephone numbers, fax numbers, email addresses, URLs, things along those lines. Those have to be removed to have a de-identified data set. Then you have unique numbers that identify people or their belongings. So things like their social security numbers, their MRN numbers, any sort of an insurance plan beneficiary number, any account numbers, certificate or license numbers, vehicle license plates, also serial numbers and device identifiers. That last thing in that row is a cardiac pacemaker. Those often come with unique serial numbers that are recorded in the patient's charts. So if you're doing a de-identified data set, you can't have any of those identifiers on it. And finally, we have any information that places a person at a particular place at a particular time. And that usually includes all elements of any dates, date of birth, date of service, discharge dates, anything along those lines. With birthdays, you can't record the date of birth, but it is okay to record somebody's age, because there are a lot more people who are a particular age than that were born on a particular day. So it's okay to record that age in a de-identified data set, but not necessarily the date of birth if that's what you're going for. Internet protocol numbers, IP addresses, again, are part of information that places a person at a particular place at a particular time too. So those are also not allowed. And the rules also say, even though it calls out these things specifically, it also says that any other unique identifying number, characteristic, or code or other info that could be used in combination with any other information to identify somebody, that needs to be scrubbed from that too, even though it's not specifically listed out. So if you are, and somebody mentioned here, I see in the chat, unless they're over 93 years old, that is true. If you're when you get into those older ages, that could actually, even just the age can be an identifier too. So that's a specific case in which you can't record the age. So overall, you need to remove all of these things from your data set if you're going to consider your data set de-identified and try to do it under a non-human research approval in that manner. And one final note about this is that coded data is not considered de-identified unless you don't have access to the key. So you can't take all of that stuff off your data set and put it in a filing cabinet, but you can still open the filing cabinet and find out who belongs to which part of your data set. You actually have to not be able to put the data back with the identifiers for your data to be considered de-identified and fall under some of that non-human research regulation. All right. Well, let's go back to our categories of IRB review now. The next one that we have is exempt. And exempt research has to be minimal risk, first of all. It has to be a very low risk of actually harming somebody and fall under one of 6 specific categories that are listed in the common rule. And these categories are comparison of educational techniques, educational tests, surveys, interviews, or observations of public behavior, benign behavioral interventions, data or specimens that were originally collected for other purposes, a study of public benefit or service programs if they're approved by a federal agency or a department head, or taste and food quality evaluation or consumer acceptance studies. So those of you who are old enough to remember the Pepsi Challenge can be done under exempt research because you're doing a food taste evaluation, right? Whether people like Pepsi or Coke better. This exempt research can only incidentally include prisoners, and there are additional rules regarding studies involving interactions with children. So if you're specifically working with a pediatric population, you need to check and make sure that your study will actually fall under these exempt categories. And also the FDA regulated research that involves a test article cannot be exempt under FDA regulations. So you can't ever do FDA regulated items under an exempt research category. This is only Health and Human Services research. So exempt research is going to require institutional updates only if identifiable data is collected. Examples of exempt research include chart reviews, surveys of adults. Surveys of children actually come under the next category, and comparing educational methods. Those are some things that you can do under exempt research. That's not an exhaustive list, but those are the kind of things you can do under an exempt research category. And as far as IRB requirements are concerned, we do require an IRB review if you're doing exempt research. And generally, we will give you a 3-year expiration date from the date of your last activity with the IRB. So when you submit your application and get it approved, that 3-year timer is going to start ticking. And your study will automatically expire 3 years from that date, unless you come back to the IRB with either, some sort of an amendment or even just a letter saying, hey, I need more time. We can restart that clock again from 3 years. One exception to that is if you've got a clinical trainee who's going to leave the health science center in fewer than 3 years. They'll generally put that expiration date at the time that your trainee, your resident, is going to leave the health science center. So it might be a little bit earlier that way. If you're collecting identifiable information here, then we're going to require an update. The OCR is going to require an update every 3 years, and you have to do an inactivation when you're completed. But if you're not collecting identifiable information, that's not going to be an issue. And finally, just so that you know, if you're doing exempt research, you do have to submit any changes to your protocol to the IRB for further review, just so that we can look them over and make sure that you're still in that exempt category and that you haven't drifted over into one of the other approval categories. All right. So next, we have the expedited review. Some non-exempt minimal risk studies may be approved by expedited review. And again, we have a list of categories under which things will qualify for expedited review. All of them do have to be minimal risk. And let me point out at this point too that they call this expedited review because it's a little simpler for the IRB office. It means that your study can be reviewed by a single designated reviewer instead of the entire IRB board. And it's not necessarily faster. The word expedited kind of makes it sound like it might be faster, but that's all going to depend on how busy our expedited reviewers are at the time. So don't necessarily expect a faster turnaround. We have a pretty fast turnaround for both expedited and full board review studies here, but that's why it's called expedited. It doesn't necessarily mean it's going to be faster from your end, unfortunately. So let's talk about the different categories that you can do expedited review in. First of all, there's FDA-approved drugs, in vitro diagnostic tests, or devices that don't require an investigational device exemption from the FDA. So really what that's talking about is drugs that are already on the market, things that are already out there that for people to use without special FDA approval. They're already FDA approved to be sold and used by people. Then you have collection of blood samples. Non-invasive sample collection. So if you're doing cheek swabs, saliva collection, maybe some hair clipping, something along those lines, that would be non-invasive data collection, or non-invasive sample collection, sorry. The next one is non-invasive data collection. There you're talking about maybe EKGs, the EEGs, things that you're collecting data from the surface of somebody's body, things along those lines. Materials that are collected for other purposes, either clinical or other research, maybe extracted teeth would fall under those types of things if you're using identifiers, possibly. Then we have recordings, either video recordings or audio recordings, and surveys, interviews, or program evaluation can also be under expedited review, depending on what they involve, if they're not already if they don't already qualify for exempt review. And so your expedited research studies usually only require institutional updates and not IRB reapproval reports, yearly annual reports. Examples of these are going to be things like prospective collection of clinical data or specimens, as long as it's, again, minimal risk. Non-invasive measurements and surveys of children fall under this category. And our IRB requirements for these is that we are going to require IRB review. We're not going to necessarily give you an IRB expiration date unless we think that you need one for some reason, that there's some reason that we think that you actually need a final date to stop the study. Otherwise, you can just keep doing it as long as it takes. And you do need to submit any changes again to the IRB. The IRB needs to look over them to make sure that you're not bumping yourself into another category with any changes that you might have. So that's our requirements for expedited review. We are also going to require an update every 3 years from the OCR to make sure that everything's going okay. And you do need to submit an an inactivation when you're done, unless the IRB determines that we need more frequent updates than that. So that's the general rule for those. And then we have our final IRB approval category, which is full board review. And full board review is basically used for any studies that don't fit any of the other approval categories. So this is going to be anything at all that's greater than minimal risk. We also put anything that involves radiation, x-rays, those kind of things automatically go to the full board. And anything that might be minimal risk, but just doesn't fit into those categories, those actual criteria for expedited review. And when you have a study that's been submitted and approved by the full board, the board has to review those at least annually. That's actually written into the federal law. So no, we can't excuse you from doing your progress report every year. We are actually required to do that. So please, get those progress reports in on time so that your approval doesn't lapse. If we can't see it in time and make sure that everything's still okay, then you have to stop your research in the middle, and nobody wants that. So, make sure you get those progress reports in, especially if you're doing a full board review study. All right, so that's kind of the overview of IRB approval here at the Health Science Center. And in parallel with the IRB review, these things kind of happen at the same time. We also get institutional activation. And that's going to include the UT Health Office of Clinical Research and any reviews by UHS, the VA, our other affiliates. And the purpose of the Office of Clinical Research is to ensure that UT Health requirements have been met. So they're going to look at things like whether your team has completed all of your city ethics training before you get started. The city training is required for all investigators and research staff that are conducting human research at institutions using the Health Science Center IRB. There's special modules that VA researchers have to complete, so make sure that you get the right ones done depending on where you're doing your research. Other things that the OCR checks, they check that there's a research scope of practice that's been filed for any team members that you might have who don't have any sort of a medical license, to make sure that they're not doing anything that they're not allowed to do. They will confirm that our research committees have approved your research, things like if there's biosafety issues or radiation safety issues, things like that. The OCR is going to make sure that all of that is taken care of. We're going to keep an eye on your drug and device storage if you're doing any sort of an FDA regulated study, or anytime you're using drugs and devices, to make sure that that's all done above board. If you need help with recruiting participants through the Find a Study website, that's something else that the Office of Clinical Research can help with, as well as study registration on clinicaltrials.gov. If you have a clinical trial, you are required to, in most cases, to register it on clinicaltrials.gov. We've got people at our office, Cara Nyland specifically, who can help you get those clinicaltrials.gov reports done so that you can publish your research after you're done, and so that everything is reported like it's supposed to be. And finally, the OCR also handles institutional activation for studies who are using an external IRB. I saw that we did have a question about external IRBs, whether things were different. If you're using an external IRB, you're going to fill out an application and give it, and the Office of Clinical Research is going to review it. So our IRB won't look at it, but the Office of Clinical Research will make sure that all of the agreements and everything are in place to make sure that we're doing everything the right way. So you're going to be working with them if you're using an external IRB. And again, if you're working with our affiliate institutions, either University Health System or the VA, they're also going to be reviewing your protocol during this institutional activation stage. So after all of those approvals, once you've got your approval from the budget and billing stage, the IRB stage, and the institutional activation stage, that's when you're finally allowed to start enrolling your research subjects at long last. So the next question you might have, if you haven't done this before, is how exactly do you get started doing all of this? Well, we'd like you to get started from the VPR services website. this is the address. It's www.uthscsa.edu/VPR/services. That'll get you to this page that's shown on the screen here. You can scroll down the page, and you'll see down here at the bottom a section that says approval stage, and you can click on getting approval for your human study, and that will lead you to where all of the forms and things are that we need you to fill out to start the process. For those of you who are a little bit more familiar with what's been going, how these things work, we also have a quick links section that you right under that search bar at the top, and you can go directly there and click, and there we go. Click on forms down there, and that will get you right to your submission forms if you already know what the process is and you just need the forms and need to get going. Once you've clicked on the starting your study section, you're going to get a page that looks like this. You want to click on the appropriate category of research based on those ones that I was just talking about, you know, whether it's a clinical trial, a non-clinical trial, what category or review you need, whether it's full board, expedited, et cetera, et cetera. And then once you click through there, you will get a page like this for the particular type of study that you're submitting. It'll give you those criteria, just like we just talked about on this page. And then when you scroll down the page a little bit, you'll see the required forms for submitting those kinds of studies. And you'll see here that there are a couple different categories of forms. First of all, there's a set of forms that's required for initial submission, and that everybody who's submitting a study in that category will need to fill out the forms that are listed there. Then there's going to be a whole bunch of other forms on there as well, and don't panic, because you don't have to submit all of those. They'll be marked as submit as applicable. And those are just there because there are so many different studies that are going on at the Health Science Center. Different forms have different studies have different criteria, so we've got different forms that you only have to fill out if they apply to your study. And filling out those required forms are generally going to point you to which of the applicable forms you also need to fill out and submit. And let me just point out a couple of forms that are real special use forms that you might want to be aware of. First of all, you have our Form J, which is the HIPAA waiver form. Generally, you're going to need a HIPAA waiver if you're doing some kind of a chart review, just because you're not going to want to have to go out and contact every single person whose chart you're going to look at. So you probably need a Form J in that case. And then down here a little bit farther, we have something called a Form M. And Form M is not actually a form, it's a placeholder for whatever data collection instruments you're going to be using during your study. So we want to see your surveys, we want to see your questionnaires, we want to see even your spreadsheet if you're collecting data that way, just so that we can see what information that you're collecting. So you need a Form M there, which is just your data collection instrument if you're doing chart reviews or surveys or questionnaires or anything like that. All right, so let's talk briefly about best practices for quick approvals. Everybody wants to get through our offices really quickly, so here are some pearls here that will help you get through the process quickly. First of all, make sure that you're reading your application forms carefully and answering all of the questions completely, because we need you to give the IRB the information that they need to make those 7 determinations that we talked about earlier. If you haven't answered the question, then then the IRB office is probably going to have to come back to you and say, you know, hey, we need the answer to this question so that the IRB can decide whether your study's safe or not. Try to have your ethics training completed before you even get started, and then that'll be one less step that you have to take once your study's approved. So you can do that at www.cityprogram.org. Just sign up for that. We've got some more information we'll talk about later about how to get that done. We recommend that you don't reuse forms from prior studies when you're doing this. You may think that you're saving time by just, you've already got all this information filled out and you're going to do almost the same thing. So you're just going to like copy the form and just change the things that'll change. We don't really like you to do that for a couple different reasons. First of all, you may miss things if you're doing that and not fill in things that we need to know. And secondly, we do update our forms from time to time, and we want to make sure that you're on the most current forms and answering the most current questions for that. So, please download fresh forms from the website every time that you do a new study, and don't reuse forms. It'll just slow you down if you do. And please ask us for help if you have any questions. Everybody in our human research approval offices we're very friendly, helpful people, and we're happy to help you with anything that you need. I'll say a few words about that in a couple slides from now, but please call us if you have any questions at all. And then a quick slide here about after approval, what are your responsibilities? Just kind of an overview of what you need to be thinking about once your study's underway. First of all, the first and foremost thing is always protect the participants' rights, safety, and welfare above all else. We have all these rules in place that need to be followed about submitting your amendments and making sure you don't do anything that's not in the protocol. But if there's somebody who's going to be in danger if you don't do something, do it first. If it's something that can't wait for the IRB's approval and somebody's going to get harmed by it, then take care of that first and then tell us about it afterwards. If you can wait, get the approval first. But if you really need to protect someone, do that. Again, follow your approved protocol as it's written. The IRB has approved your protocol the way it was submitted, and if you start changing things, then you're not really approved by the IRB anymore. And make sure you submit those amendments before you change anything so that we know what you're doing and we're okay with it. Be aware that principal investigators are directly responsible for all aspects of their studies. And so make sure that you know your responsibilities as a study team member and supervise any other team members that you're in charge of to make sure that they're not doing anything that's out of line from what's expected on your study. Because if your PI can get in trouble with that if there are people who are not doing what they're supposed to be doing, and you don't want that to happen. You need to promptly report any unexpected problems involving risks to subjects or others to the IRB so that we can review those and make sure that there are no changes that need to be made in your study to prevent that from happening in the future. Please submit the updates, as I mentioned earlier, as required to maintain your approvals, and submit your final reports when your research is completed if you need to do that. And finally, when you're keeping your research records, your documentation of what's going on, make sure that your records are attributable, meaning you know who wrote them, legible, you can read them, you know what they actually say, contemporaneous, meaning they were written at the time that the actual action happened. They're original, don't just keep the copies, keep the original documents so that we know what's going on. And finally, that they're accurate, that they reflect what really went on in the study. All right, and that was a really quick overview of everything that happens in our office. But as I mentioned, if you still have questions, please come and contact us. We're always happy to help. There are a number of different ways that you can do that. First of all, we have our research concierge service. You can schedule a half an hour with anybody from any of these offices and talk to them about your protocol. If you're not sure how to fill out your application or any other questions that you might have, they would be happy to help you with that. The way you get one of these concierge appointments, we used to do them in person in the library, but now they're all done online. So you can go back to that VPR services website that I mentioned earlier. And in this case, you're going to scroll down the page and click right over here where it says concierge services, and that's where you can set up an appointment to talk to somebody about your questions or your project. Another way that you can get in touch, that you can find out some things that might be useful to you is through our research learning library. This is something that we've set up through the Canvas CE platform, which is the continuing education platform. This is separate from the Canvas that's used from hosting university classes, so be aware that your regular Canvas login won't work necessarily on the Canvas CE platform. These things are actually reference resources and not traditional courses where you go through them step by step. It's just kind of a repository of things that you can go and read and find out what you need to know for your study. We're adding to these all the time. It's kind of a work in progress. So check back from time to time and see what we've added. We're enrolling people in the Human Research Required Training course as they come in on the IRB applications. And you can self-enroll in the self-service course once you're in the system there. If you want to get into the self-service course, let us know. If your UT Health username and password doesn't work, and we can get you signed up for that. So basically what you do is you can come to this address for the Research Learning Library. You click on this self-service learning and aids tab, and once you're logged into Canvas, you will see this page, and it's got all of these wonderful buttons on here with different topics that you can learn about. This is what we've got up here right now. We've got everything from becoming a certified clinical research professional, some HIPAA things, some informed consent things, a lot of useful things. And again, we're going to be adding to this over time, and we're also starting to put together as a dedicated research coordinator course as well. So be on the lookout out for that in our research course, and of course we'll be letting you know more about that as it develops. All right, and if you can't answer your questions any other way, you are always welcome to call us as well. We have contact information for each of our offices. If you need a quick question, maybe not a half-an-hour concierge appointment, but just something quick that you need to find out about, let us know, contact us, and we're always going to be happy to help. All right, and that is our quick and dirty overview of everything. Let me get out of this slideshow so that we can get back to everybody. And I see that we've had a few questions in the chat, which I can leaf through here. Let's see what we've got available.
The first question that we didn't get to, Krista,
yes.
Was, can budgeting and IRB proceed in tandem?
So generally what happens is to make things as efficient as possible. If you're running a clinical trial, we want to make sure that you go through the clinical trials office first for your initial review, just because oftentimes the clinical trials office has a lot of back and forth, and they kind of need to get things settled before the IRB will be able to review it. We don't want the IRB reviewing it and then have things changing afterwards. That's just not the best way to get an approval as quickly as possible. If you're not doing a clinical trial, then your approval goes directly to the IRB. Your application goes directly to the IRB, and we can start with that, and then you have your budgeting and your IRB happen in kind of at the same time. But usually if you're having a clinical trial, we want to get things a little settled with the CTO first before you come to the IRB.
Another question was, with the greater use of central IRBs, does the work process still have the same flow?
So again, if you're using a central IRB, I kind of mentioned this a little bit during the presentation, you're going to mostly be working with the Office of Clinical Research. I believe we have one central application that you're going to be, actually, let me take that back. I think you can go directly to the OCR. Brandy, if you're on and have any clarification of this, please let me know. But I think if you're using a central IRB, you'll be filling out some institutional forms so that the OCR can make sure that everything is happening there. And usually we need an agreement, oftentimes what's called a SMART IRB agreement with the central IRB. If it's one of the big ones that we work with a lot, we'll have a lot of that stuff in place already. But if it's not, then we maybe need to work out some of this stuff. So it really depends on who you're working with. And Brandy Otten at the Office of Clinical Research can help you figure out all the details of that. It's really best to go to Brandy and find out what needs to happen if you're working with an external IRB.
And then, another question was, could you explain the process of Mays Cancer Center IRB versus UT Health IRB?
All right, so the UT Health IRB is actually the IRB of record for the Mays Cancer Center, but they have their own CTO office. So the CTO office over at Mays is, from what I understand, they handle a lot of the submission things over there a little bit differently than we do here. I think they do a little bit more handholding. And I apologize, I'm not as familiar with how the process works over there, but eventually your approval is going to come through the same UT Health IRB, whether or not you're a cancer study. But the CTO, I think, helps a lot with some of the paperwork and getting things put in order to be submitted to the IRB.
The other one, and Matthew, I can answer your question about the CDA offline. The other question was, is the protocol review the same as IRB review? Do you assign a protocol to an IRB panel depending on their expertise or as it's available?
Okay, so yeah, basically, your protocol and all of your supporting documents is what's being reviewed by the IRB for safety purposes. So that's that big application. You could probably call it a protocol review or an IRB review, either one. We actually, here at the Health Science Center, we have 2 different main IRBs that review these studies. They meet every 3 weeks. And generally, your protocol will go on the agenda for the next available meeting once the Office of the IRB has decided that they have everything that they need for the IRB to review it. And we will make sure that there is expertise on the IRB panels to cover your particular protocol. You're not going to have to wait, for the next meeting. For expertise purposes, we can call in outside experts if there's nobody who's actually sitting on the IRB who has expertise in that area, and we think that we need some special expertise there. But yeah, basically, as soon as you get everything in, all the forms are complete and everything, they're going to put it on the agenda for the next upcoming IRB meeting, and those IRB meetings happen every 3 weeks. So there's no waiting for particular expertise in those cases. And let me just mention that our IRBs have something in the neighborhood of 20 or 22 people on them, and we try to get a good mix of people with different expertises. So hopefully there will be somebody who's already on the IRB who will at least have some knowledge about your protocol, so we don't have to call in one of those outside experts.
Last question that I'm seeing here, Krista, is after you download forms and fill them out, where do you submit them and track your IRB review status? Is there a platform? So if I may take this one,
Go ahead.
Right now you submit them to the IRB office. There's a general email box. However, we are in the process of bringing online a new software that's going to facilitate those submissions, and you'll be able to see in real time where your IRB application is in the approval process. Right now, there's not really a way for investigators to see that with as much clarity as we would like, but the new system, it's a Huron platform, will go live at the end of this calendar year and provide that flexibility and functionality for our investigators.
All right, thank you, Melanie, for that. We're really looking forward in the IRB office to having this software available, and hopefully it's going to make things easier for everybody. We've got just a couple minutes left in our session. Are there any final questions? If anybody has something that they want to ask, you can unmute yourself and ask it. And if not, with this session is being recorded, and we'll post it up on the VPR services website, that same website that I mentioned in the presentation here. There's an area where you can link to called archives, something like archives of forums or something along those lines on the main page. You'll be able to get that in hopefully the next couple of days. It just depends on how long it takes to get everything processed and uploaded. I think we'll be sending out a follow-up notification once that's ready for everybody to view. And other than that, please let us know if you have any questions at all. Thank you to everybody who's saying thank you, and have a good afternoon.